All right, here we go. Bear Peak Summit attempt number 2. We shall see if we get there this time. We're running a little late on daylight today. And there's some storm clouds up there, so hopefully we can get there, get it done, and we'll teach you guys a little bit along the way. All right, let's have some fun. So the first 2 miles are always brutal because you've got like this gradual incline and you're not warmed up yet. So this little gravel path I like to use has like a little cool down in between running from the house and getting here. I don't know why I do this. This is not fun right now. Hurting. Well, I know how I do it. Today, for the second time, Natasha's not with me. Her mom flew into town yesterday, so she's entertaining. So I'm out here doing it for y'all. The goal is to teach you on these videos, little bunny, but also to encourage you to get out there. Whether you have an injury or you're struggling with a chronic condition, whatever you're dealing with, take advantage of every day and get out in nature. Three miles in, finally. Another little quick break. Having some pain in my left foot. Does not feel good. But I know I've been doing this stuff long enough to know that the pain will work its way out. Just keep going. Kind of like if you're having a bad day with a thyroid condition or an autoimmune condition, you kind of just got to keep plugging away. Whew. I can barely breathe. So if you all watched the Crater Lake video of Natasha and I, that's the one where she wasn't having a great day out in the mountains. But she literally just put one foot in front of the other one and physically just brought herself to a better place mentally to overcome the negative physical space that she was in at that time. So we all got to do it, whether it's climbing some silly mountain or you're trying to take care of your children and you have tons of brain fog and you're not feeling well, you're low on energy. One foot in front of the other. You'll get there. All right, recently, this past week, I posed a question to our Facebook members and I said, what do you want to learn? One member mentioned killing H. pylori. H. pylori is not difficult to get rid of. You just got to know all the bases to cover. So let's start with this. Number one, if you're a parent and you have children, small children, test your children. H. pylori is the easiest infection to give to somebody. You can give it to them through kissing. You can give it to them through, I'm out here by myself, so I kind of get paranoid about bears. You can give it to your loved ones by sharing glasses, forks, eating off the same plates. Test your family members. I've seen family members give it back and forth to the patient. I've also seen the family dog give H. pylori back to, well, I should say, this is what was happening. I was treating the mother and the father for H. pylori. Wasn't going away. Tested the children. It was there. Started treating the children. Wasn't going away. We did multiple rounds. Was not making sense. I finally asked, do you have a dog? Guess who the dog was kissing? The kids. Guess who the kids were kissing? The parents. So you got to make sure you're not cross-contaminating. Get rid of your toothbrush very frequently. I say get some cheapy ones for a few weeks, throw them away every single week. And then I use a product, I used to, but my first one is called AskDrKing. And this is a product from Premier Research Labs. I'll have patients, I get paranoid when I hear noises. I get patients using 2 to 3 to 4 of those, depending on how bad the H. pylori infection is. They open the capsules, put them in warm water, drink them like tea, and they'll do that several times throughout the day. At least 3 or 4 times. Then we retest. I like the urea breath test for H. pylori. To me, that's the most sensitive. You can rely on white blood cell panels, but not always the most sensitive. So as they spend 100, I think it's like 109 to 120 bucks, depending on the company. But your traditional doctor can also order that through insurance. If your insurance isn't going to cover it, then we can run it for you. So that's how I treat H. pylori. It's not a really difficult infection to get rid of. One of the main causes for it is having low hydrochloric acid, low HCl in the stomach, and your stomach doesn't have enough HCl or is not releasing it properly to kill off infections. And that's one of the #1 causes. So as we're killing off the infection, we'll get the patient or patients to use some hydrochloric acid. Whew, about lost my step. And make sure they have really good stomach function. So kind of another tip, if you will, for H. pylori. All right, now I gotta get to running because the sun's going down. I have a feeling I'm not making the summit. Another question that a member asked was, how do you heal IBS? Well, that one hits close to home because I had that growing up. Not fun. Not fun at all. So here's my few tips. 1, make sure you don't have any infections, whether that's some type of bacterium, parasite, fungal. You want to get rid of all those infections. Test for them. Talk to your doctor. If your doctor won't do it, find a new doctor. And then you've got to change your eating. You must. I mean, I grew up in South Carolina, drinking milk with every single meal. I mean, we didn't know about gluten and dairy back then. I was always super bloated, gassy. Always had to run to the restroom. Always had allergies. You've got to clean up your eating. If you don't know how to do that, here's the 3 big foods to stay away from. Wheat, dairy, and soy in the United States. Stay far away. And then stay away from nightshades. Peppers, eggplants, tomatoes, stay away. Reinoculate your gut with good bacteria. I was a kid that was on tons of antibiotics. Good bacteria. And then use a product to heal your gut. I love a product called RepairVite, but there's other products out there. But you got to use something to heal your gut. So get rid of infections, change your eating, reinoculate with good bacteria, and patch up the gut lining. Bam! That's how you fix IBS. All right, we are at kind of a false summit. It's like a little saddle here as you're working up to Bear. But I wanted to show you a really cool view. So take a look at this. How gorgeous. That is where we ended up last Sunday. So if you haven't watched that video, make sure to watch it. And I think we're gonna be good. We're gonna go for it. I got a little bit of summit fever. This last portion is kicking my butt. My heart, I tell you, I'm probably 180 beats per minute right now. I feel like I'm cycling. This is not easy. Starting to see blue skies. It's good news. Means the summit is coming up. Sure didn't time it to be up here when the sun was setting, but it is what it is. And we are way down there, back home. Pretty pumped. Check that view out. It doesn't get much more beautiful than that. This is what life's about. Adventures. All right, so one funny thing, when we hike, Natasha normally hums or whistles, but if she just like makes things up, you have no idea what she's whistling or humming. I was doing the same thing just now, the whistling part, because I've always heard that just make racket so you scare off the big wildlife. So I was whistling Welcome to the Jungle for probably the last 15 minutes, as loud as I could. All right, another question that a member asked was, how do we lose weight? And this is one of the most common questions that I get asked. And I got a really cool story / testimonial this past week. There was a gal that I worked with. She lives outside of Chicago, and I worked with her about 2 years ago and got her feeling better. And then, as like all patients and doctors, we kind of drift apart once you're doing better. And then maybe 6 months ago, she reached out to me and she's like, Doc, I need your help. I went to another doctor here just thinking that I'd find somebody local, and I just need your help. I won't go into the details. So anywho, talked to her this week. We followed up on some thyroid markers. So we ran all 10 thyroid markers. She does have Hashimoto's, okay? And when I talked to her on the phone, my first question is, well, how are you feeling? Before I go over her lab results, you know, how are you feeling? How are you doing? She's like, oh, I feel great. I was like, wonderful. And I was like, well, tell me more. She goes, I've lost 20 pounds. I was like, holy moly. I was like, I would expect you to based off your labs. So the last time I ran her labs, her TSH was a little bit elevated and all of her main T4 and T3 hormones were low. This time I get her labs back, every thyroid hormone is perfect. I'm talking, if I could have every patient with perfect hormones like that, well, gosh, I wouldn't need patients, or I wouldn't have patients because they wouldn't need me. So this gal, 20 pounds down. The other thing that she's done is she tightened up her eating. I was like, well, tell me about it. She goes, well, I'm cooking more at home for my family. We've stopped going out to eat so much. I stopped eating the carbs. I've gone back to being grain-free, and I feel really good. Like, I'm super pumped for her because that was a goal of hers. And she wants to lose, I think it's 8 more kilograms, roughly, I think like 16 more pounds. And she will. I mean, her thyroid's kicking butt. She's back onto her eating program. We talked about increasing her exercise routine and her intensity. So she's going to start doing that as well. So to answer the question, how do we lose weight? Well, we got to make sure all the infections are gone. I know the patient who asked me that had a surgery recently. So there's probably some inflammation still going on from that. Detoxifying the body, working on those genetic mutations. You know, once you've got all those underlying problems managed properly, then you start attacking those thyroid hormones. And when you do that, you have really cool results like this gal did this past week. And I'm probably going to use that on an upcoming video. I'll show you her before and after test results so you can see them and compare them for yourself. But that's how you lose weight. You got to go after all the layers of the onion. Infections, detoxification, gut health, stress, everything that we talk about a lot on our social media and our websites. Like, that stuff works. Like, you just do it. It'll take time, but it works. I promise you it works. And then you can have results like this gal right outside of Chicago. Can you see them? City lights. We're getting closer. All right, well, we're almost home, and this is not my normal way I go home. I went to go continue down the trail that I normally take and saw some big old green eyes. They're hanging out in the bushes, and it was still a ways away from me, but I could make out that it wasn't something I wanted to run near because it was not afraid of me. It was not moving. So I took the easy way home, and yeah, we made it. Another summit down. We'll see you on the next one.